Hello everybody, I am Dr. Amal Roy Choudhary. I am working as a director at Fortis Memorial Research Institute, Gurgaon. This hospital is equipped with complete cancer care that includes surgical oncology, medical oncology and radiation oncology. I would like to talk today about my branch, which is radiation oncology. In 60% of the cancer patients, radiation therapy plays a very important role. At some point of time in their journey of treatment for cancer, patients would require all three modalities: surgery, chemotherapy and radiation therapy. The combinations may vary. They may require surgery and radiation only. They may require surgery and chemotherapy only. And sometimes they may require chemotherapy and radiation only. There are patients of cancers who may require only radiation and chemotherapy. For example, head and neck tumor patients, quite a large number of percentage of patients, they require radiation as the primary treatment along with concurrent chemotherapy. Concurrent means the chemotherapy which is given along with radiation during the course of radiation. The doses of chemotherapy is small doses which are given every week once. Radiation therapy duration, most of the people are concerned about the duration. The duration can extend from 6 weeks to 7 weeks. In head and neck tumors, we require 7 weeks of treatment. 6 to 7 weeks of treatments are required. In other sites, the treatment can be sometimes as short as less than a week or even a single treatment, which we call as stereotactic radiosurgery. So radiation therapy, for the general population or for the common man, the question is, what is it? What is radiation therapy? Everybody can understand what is surgery, what is chemotherapy, but radiation is one branch about which overall understanding is not clear in general population. So radiation is nothing but it is a use of high energy X-rays. X-rays are being used for diagnostic purpose routinely, whether it is chest X-ray or CT scans. But in radiation, the X-ray quality has got a high energy through which cancer cells are killed. Their the DNAs are killed, broken, so that they cannot multiply. So the patient does not experience any pain while the radiation is being delivered. Yes, there are certain side effects with radiation depending on which area is being treated. For example, when we are treating head and neck area, this area, then patient may experience swallowing difficulty, mucositis, that is inflammation in the oral cavity or in the neck mucosa, which makes the swallowing little difficult during the course of this whole 6 to 7 weeks treatment. For that, we often consult the patients every week and guide them, give them medications through which these are manageable side effects. But yes, proper education and information to the patient is given prior to the start of the treatment regarding side effects pertaining to that particular site which is being treated. For example, brain tumor is being treated, then what are the side effects with respect to the brain tumor? Similarly, when the pelvis area is treated, for example, cancer of the rectum, cancer of the cervix, cancer of the endometrium, when these sites are treated, intestines also get some amount of radiation dose, because of which the side effects can be slightly different. So we inform the patients regarding the side effects, and we also tell them what to do, what not to do during that period of treatment time. For example, certain dietary restrictions, such kind of precautions we advise them. But most of the patients, nearly 100% of the patients, they go through the treatment smoothly with minor side effects affecting them during the treatment. A proper counseling is being done from our end to explain about the side effects as well as its treatment. Now, coming back to radiation therapy, as I mentioned, can be used in several cancers: brain tumors, head and neck tumors, lung cancers, especially advanced lung cancers. It forms one of the backbone of the treatment. Breast cancer, especially women who have undergone breast preservation, where the breast is not removed, only the tumor has been removed. In them, the radiation forms one of the most important pillars of the treatment to prevent the recurrence. Where the breast has been completely removed, depending upon the histopathology or the surgical report, the decision for radiation is taken. Going forward, in abdominal tumors, radiation can be required for stomach tumors, pancreatic tumors, gallbladder tumors, tumors of the rectum, tumors of the urinary bladder, tumors of the endometrium, that is a uterine cancers, tumors of the anal canal. In fact, for anal canal tumors, it is one of the most definitive treatment and has an excellent response along with chemotherapy. Similarly, when we have tumors like soft tissue sarcoma, these are tumors involving muscles and bones. When a patient can have in a hand, or these kind of tumors can arise in the muscles of the legs. These tumors, sometimes we get them operated, and while patient is being operated, the radiation is delivered at that time. That is called as perioperative radiotherapy. So radiation has a very important role in the management of cancer. Common myths are that radiation can be very harmful. It is not harmful if done under proper supervision. In fact, it brings about cure in majority of the patients. So fear of radiation is uncalled for. You must meet your doctor, discuss in detail about whatever fears you have, the questions in your mind you have, so that we can prevent you from a myth which, a lot of patients avoid coming to doctors for receiving radiation simply because they have heard from somewhere regarding the side effects or regarding not complete information regarding the same. So meet your doctor, talk to them one-to-one, discuss in detail, and do not be scared to receive radiation. Thank you.